Our patient is Jenny Smith. She is a 40-year-old female, no relevant medical history. She's not on any medications. She's allergic to Septra, and her reason for seeking care is right lower quadrant pain and extreme nausea. This case is a second-level priority due to having normal ABCs, normal vitals, but she has acute pain and abnormal lab value. Onset of symptoms was 2 days ago. The location was the periumbilical area, which has now moved to the right lower quadrant. Duration was 2 days. Character, vague diffuse pain with extreme nausea. Aggravating factors were not stated, but a common presentation would be movement, coughing, and deep breathing. Related factors are anorexia and nausea. Treatment was not stated if she had tried anything, and severity is not stated, but appendicitis common presentation is severe pain.
There are no risk factors we deemed pertinent for this case. No social history was provided, and we don't believe social history would be an important part of this case, as appendicitis does not have any social history risk factors. Additional questions we would ask. Do you feel any pain during movement, coughing, or deep breathing, as appendicitis usually presents with these aggravating factors? When did you notice your appetite loss, as anorexia is one of the first signs of appendicitis? Is your abdominal pain or discomfort constant or intermittent, as appendicitis often presents with intermittent pain? How often do you usually have a bowel movement, as we need to establish a baseline for our client's bowel movements in order to determine if data is abnormal or not? Rate your pain on a scale of 1 to 10, as appendicitis can be extremely painful.
The nurse will assess bowel sounds to rule out bowel obstruction, as well as assess for appendicitis and rebound tenderness. These tests would only be useful if the patient can tolerate the exam. In this exam, we would prioritize special tests for appendicitis. If time allowed and the patient could tolerate, we would do a full abdominal exam. Red flag findings in this exam would be positive rebound tenderness, McBurney's point, Pessoas test, obturator test, positive Rosving sign, involuntary guarding, and hypoactive bowel sounds. Screening tools that would be useful are the Alvarado score to diagnose appendicitis.
Migration of pain to right lower quadrant, anorexia, nausea, tenderness of right lower quadrant, rebound pain, and leukocytosis give an Alvarado score of 8.
Vital signs are within normal limits. I would like to obtain a temperature to assess for fever.
Red blood cell tests are routine evaluations that can be indicative of many disorders such as chronic illness, hemorrhage, or genetic disorders. The findings say that the patient's red blood cell count is within normal limits. White blood cell count is another routine blood work to test for the presence of infection, neoplasms, allergies, or immunosuppression. The patient's white blood cell count of 11,500 cells per microliter indicate a slight elevation in white blood cell count. Elevated white blood cell count can be due to inflammation, infection, necrosis, trauma, or stress. Urine beta HCG is a pregnancy test. It is tested to rule out pregnancy, ectopic pregnancy, which can also present with similar symptoms such as abdominal pain. The findings are that the patient is probably not pregnant, but during the early stages, this can produce a false negative result. The urine analysis is a common diagnostic and screening tool for patients with abdominal pain. The findings are within normal limits, meaning the urine is clear, amber yellow color, aromatic with a pH between 4.6 and 8.0, and free of abnormal bodies such as ketones, red blood cells, or nitrites. The results rule out urinary tract infections and other diseases or disorders that may have similar symptoms. The point-of-care laboratory assessments the nurse would complete without an order would be the urine analysis and urine beta HCG test. Our first nursing diagnosis is nausea related to stomach pain, as evidenced by verbalization of extreme nausea. The second nursing diagnosis we have is acute pain related to an inflamed appendix, as evidenced by a pain scale. The final nursing diagnosis is risk of fluid volume deficit related to nausea and decreased appetite.
Based on this scenario, the key feature of the exam would be the abdominal special tests, as these procedures are crucial to distinguish possible appendicitis from other possible etiologies for abdominal pain.
The situation is our patient Jenny Smith is having abdominal pain in the right lower quadrant with extreme nausea. Background is she came into the ER today complaining of vague diffuse abdominal pain for 2 days that has moved to the right lower quadrant tonight and has extreme nausea, anorexia, and her last bowel movement was yesterday morning. She has normal vitals, HCG is negative, and she has an elevated white blood cell count, no past health history, no medication, and her only allergy is to Septra. My assessment is this patient may have appendicitis due to hypoactive bowel sounds, positive rebound, McBurney's, psoas, obturator, Rosving's, and an Alvarado score of 8. My recommendation is we get an ultrasound to confirm the diagnosis of appendicitis or to rule it out.